Hi, my name is Phil Bowden. I am 61 years old, divorced probably before most of you were born, and I currently work in the healthcare field. I have worked at the University of Colorado Hospital for almost 15 years, and many people at work have tried to encourage me to go into nursing, and I've kind of balked at that. I sometimes wonder if I really want to keep dealing with people that are as sick as I've been dealing with. I work on a step-down ICU and an observation unit. And on our step-down ICU, we get a lot of very, very critical patients. And when somebody dies, it's just very difficult for me. Um, it's it's hard to avoid being hurt because then you have to put up a wall between yourself and the patient as far as keeping you from being hurt emotionally. But then when you do that, you're just not as compassionate as you might be with your patients otherwise. Um, like I said, I'm 61, and I suppose that a lot of you are thinking that you can't make or that you're too old at your particular age, and that's not true. I mean, because here I am at 61, trying this. This is my first time in college ever. I always thought that I was too stupid to go to college based on my grades in high school. Now I'm finding out that I just have sold myself short for many, many years. I am in fact right now making A's and B's. I don't know that that's always going to happen because some of these classes look like they're pretty tough. And at the moment that I think that class is going to be easy, I find out otherwise. I went to school in Santa Fe, New Mexico for 2 years, and so experienced or had a lot of experience with different cultures then. And I also went to Catholic school here in Denver, and I found that at Cathedral High School, which is no longer, I interacted with a lot of different nationalities. And so that's probably the most experience that I've had. Like I said, I've went to school in Santa Fe. That's probably some of the most traveling I've ever done. I have been in touch with a number of people in the Philippines, and I often think about going down there just to kind of, well, to meet these people, obviously, but just to kind of get a feel for what their culture is like. I work with a lot of people from the Philippines, and they just seem very interesting, and it just seems like something that I really like to find out about. As far as my goals for this class, I think they're twofold. I used to deal with or not deal, I'm sorry, I'm fumbling here. I used to date a girl from Peru. Turned out that she was illegal, had let her visa expire before, 3 years before I met her. And I met a few people through her. Most I think were legal, but I'm really not positive of that. And so part of this class, I'd like to get an understanding of people who are illegal. Um, maybe find a way that I can relate to them. And I know being illegal does not necessarily apply to Spanish. It applies to a lot of different nationalities, whether they're from Mexico or other areas. They can be Latino or Filipino or any number of nationalities. So I'd like to come to understand, in particular, the Spanish people, and then I also want to understand. I think both of my concerns are understanding both uh, the Mexican and Latino people as far as um, their culture, and then I also want to understand them even more specifically as far as it relates to being illegal. I think there's just a lot that we don't understand about them. One of the things that I like about the Latino people, at least I primarily work with people from Mexico as far as patients that I have. And I find that it's really interesting that when they're ill, or even when they're not, when they're just in the hospital, tons of people, family members, come in to visit them. I just think that's really neat. I think it's really neat that their family is involved so much with them. And also one other note here, Professor, I noticed that you graduated from University of Colorado, and I've mentioned that I was at University of Colorado Hospital. So I just wanted to say good job. At any rate, I'm looking forward to getting to know all of you and taking this class with you, and I hope I can make some new friends from you also. And I just wish you all the best of luck and many blessings. Thanks.